Welcome to the Disruptive Social Care Podcast with social care provocateur and social media queen Shirley Ayres and myself, Stuart Arnott, founder of Mindings, a service dedicated to harnessing the power of social media to help alleviate social isolation. We're delighted to welcome Dominic Campbell as our guest on the Disruptive Social Care Podcast this week. Dominic is a digital government specialist and social innovator with a background in government policy, communications and technology-led change. Dominic established FutureGov in early 2008 and has a keen interest in emerging uses of new media and social strategies to deliver public service transformation and social innovation. Dominic is also co-founder of several social web startups. Patchwork, a collaboration tool for multi-agency working, currently focused on children and families intervention. Casserole, a peer-to-peer Meals on Wheels service, which we discuss often. And Enabled by Design, a community of people interested in design for all, something which I'm quite passionate about. And of course, Doc Ready, which involves, I was going to say our very own, because he feels like our very own, Mark 1 in 4, one of our previous guests on the podcast.
Indeed. And as you know, Dominic, we invited people to submit questions for discussion via Twitter and the Connecting Social Care and Social Media site. And we've certainly received a lot of interesting responses. Your rather intriguing Twitter bio describes you as a boy pretending to be a wolf, pretending to be a king. How does this link with your digital design and change role at FutureGov?
Well, first of all, thank you very much for having me here. It's delightful to be here. So I guess the basis of why that spoke to me from where the wild things are is where it comes from, was really around particularly linked to some of the stuff that we do around change and actually how can you kind of play that guerrilla stealth role within an organisation where we all go to work, we all have to wear our suits, although I try and avoid that as much as possible. We all, to a degree, play act when we're in our roles in that kind of environment. But ultimately, if you strip it back, we're all just human beings trying to do the best we can and make change for people's lives, particularly in the sector that we work in. So sometimes you have to pretend to be a wolf or a king. Other times you can just be the boy who's trying to make things happen.
Right. And actually, it's a very nice photo of you on your Twitter bio, wearing a suit and a tie, I have to add.
I know. I had a bit of a pop at people wearing suits the other day and someone called me out on that because I entirely forgot what was on my Twitter photo. So that was my wedding. I think if there's one day I can wear a suit, that was my wedding. So.
Absolutely. And congratulations.
Thank you.
Now, we all, Stu, you and I, contributed to the Kent Care in the Digital Age event, which was held on the 12th of July. And you raised some challenging questions about the importance of human relationships in public services and how people talk to each other. So we've had an interesting question from Cormac Russell, who's involved with the Asset-Based Community Development Network. How can we work with communities so that innovations and the shape they take can be citizen-led? And do you see issues arising when innovations are seeded by outside innovators?
I had a feeling these questions from Twitter were going to be tough. Okay, so from my point of view, I'd see no other path to innovation other than community-led. How you define community is interesting, I think. There's certainly the outside community, the user community, the client community. When you're talking about social services or any human-related service in particular. But through work like Patchwork, obviously there's a huge need to actually engage practitioner communities as well. But one way or the other, it is about how do you actually reach out to people who are either on the receiving end or delivering services and give them a voice to actually articulate where the challenges are from their point of view, but also get some inspiring ideas around how they may resolve that. And that isn't always to say that the social worker or the client is best placed to provide the answer to an exact need. A lot of the time I find that as an outsider to a lot of situations, the best role we can play from a design point of view is actually to really try and get people to just express the raw need, the real challenges that they're facing, and actually try to then reflect those back to them, go away, do some creative thinking and actually take a step outside of the situation in a way that often you can't when you're deep in it.
I mean, I think that's an important point because sometimes it feels like the innovations that are being funded by national bodies are an answer in search of a problem.
Right. Yeah.
And so then how can you embed things that haven't been identified as problems by communities within communities because they've got no ownership of it?
Yeah, no, absolutely. And I think, we're based in what is now known as Tech City over in Old Street. And
I'm keeping a straight face here.
well, I have to say that we're extremely self-conscious around some of that, in that we don't want to become Shoreditch douchebags who end up dreaming up fantastic solutions to non-existent problems, as you say. And I think that the particularly by being design-led, if you truly are human-centred and fundamentally interested in people's lives, really, stay in communication with people, try and understand at a very deep level what it is that it is to walk in their shoes, and then design around that, then I think that's fundamentally important. And I agree. But we've got good relationships with those national bodies, and I think increasingly they are talking about, you must come to us with a partnership that relates to how you can ensure that the voice of the user or the client is deep in your innovation. And as you say, if you don't have that, if you don't have evidence that you've been able to partner with those people, then how can you say that your thing is rooted in user need?
Yeah. Well, Matt Bauscher asks whether you believe that local government will survive beyond 2018. And thinking about this more widely, a substantial investment is being made in technology by health organisations and funders such as the Technology Strategy Board, Nesta and the Nominate Trust. But there's little investment from the care sector itself. And recent research suggested that only 1 in 5 care home residents have access to the internet. Do you think the lack of digital leadership and engagement within the care sector has implications for the future of social care in its current form?
So to go to the first question, I'd say yes. Fundamentally, I believe local government will survive past 2018. What it looks like and how it operates and how it governs itself, I think, is within the next 5 years going to go through a huge shift. I think there's everywhere we go around the country at the moment, you see senior leadership reflecting on that and trying to understand what is it that local government is here for, what is its unique proposition, and what does its partners do better than local government, because there are things that it can do. I think local government is best at things like holding that democratic legitimacy, pulling the strings, coordinating the strategic vision and leadership. And I think that's as true in the care sector as anywhere else, particularly where it's becoming fragmented. My fear for the care sector is actually that it becomes both fragmented at a local level to the point of inefficiency, duplication, and poor outcomes for people, confusion and complexity. But then also some of that strategic role is almost being extrapolated up to a national level increasingly as places like the Department of Health try to mash together social care and health. And I would imagine there aren't that many people in the health sector who believe that increasingly national take is particularly healthy for the sector. Health has really struggled from that national diktat, central command and control model, rather than the devolution to the lowest denominator. And I think the local government will remain having a really important role in that local coordination of bringing health and social care together, but in the right way that befits a local area rather than a single nationally mandated approach. In terms of technology, I think where we are is actually we're stuck somewhere between having no investment or very little investment from certain parts of the sector, where we understand already that there's huge cost pressures on care homes. Again, in the media today around the number of care homes, percentage of care homes that may be financially unsustainable. And in that environment, technology falls by the wayside and is seen as a bonus. But equally in local government, I fear that social care is trapped in this narrative around big suppliers, big solutions, transformative change that really doesn't represent where technology is in the world in 2013, how people engage with it, and nor does it represent the best way forward in terms of organisational design and change.
It's certainly a big challenge, and I mean, sort of taking that sort of further on. I mean, one of the major challenges for adoption of technology in the health sector has been about the evidence base for the effectiveness, which would justify the investment. And sort of put aside that sort of the issue around what sort of investment and all the rather strange contracts that local authorities seem to have with some of the big suppliers. But a question from Mike Clark. I mean, from your work, is there evidence that the health and care reforms in England are leading or will lead in the near future to better outcomes for users, patients, carers and their families? And do you have any examples linked to particular legislative changes?
So I have to admit I don't follow the legislative agenda as closely as I might, and I think in some respects that's probably come from my background in policy, which, if anything, taught me that policy and legislation comes and goes, and other than some of the more hard-edged elements of it, fundamentally the thing that transcends a lot of that is ensuring that you are designing services that are fit for humans and on the receiving end of it. And I think that essentially does transcend legislative changes. It does transcend an awful lot of what's going on. I mean, the health and social care integration piece, for instance, that has some fundamental shifts and it has some fundamental changes involved in it. But I think if you then try and go and design an NHS spine style solution from the top down to actually make that happen, unsurprisingly it will fail again. But instead, if you actually try to get to the root of what is the change that you're trying to make and who are the people on the receiving end of it, I think fundamentally that's a far healthier position to come from in terms of how to make change happen and how to use technology to make that change happen.
I mean, I think it's interesting because fundamentally what hasn't been resolved is the fact that health is free at the point of delivery and care is means tested.
Absolutely, yeah.
And a major barrier for implementing new and innovative ways of delivering services when you've got that. And also, I guess the other issue is about we have an NHS mandate, so people can be clear about expectations for health. Interestingly, that mandate does not include social care. So it's an interesting one to debate. Will the mandate expand to include social care next time round?
Absolutely. And to go back to the original question as well, the major change that I'm seeing that is forcing innovation in the sector isn't really legislation. It is instead austerity, without a shadow of a doubt. And the fact that for the first time in my 11-year career, people are actually willing to take a punt on a blank piece of paper and actually say, what could this look like that's fundamentally different? And that's where we're seeing an awful lot of what we're doing coming from right now. Instead of saying, let's chase the white paper, let's chase the legislation, it is much more about what is an entirely different way of doing things. I mean, Surrey, who are our closest partners in the work that we do, they are strongly moving towards a social capital model of social care. And while that's always been built into the ethos of social care, like where in yourself and in your community can you find the assets to achieve your aspirations and maintain your health and care, now it is actually the primary line in the strategy in terms of how people can actually try to ensure that social care can continue, frankly, at any level. And I think that an awful lot of the technology on the market doesn't represent that mind shift and that huge transition to a new way of thinking and working. It's much more about very expensive case management. Well, if you're trying to reduce the amount of cases that you have that you're trying to manage by triaging out people so that their community can support them, where's the technology that supports that? And that's very much what we're starting to get into and building.
Could I just ask, I mean, there have been a lot of papers written by care organisations about developing social capital. Are there any that stand out from the Department of Health, Think Local Act Personal, Sky, any of those that you would recommend as a starting point for people thinking about developing social capital?
I think it depends who you are. I mean, a lot of people, I'm a very pragmatic thinker, so a lot of it doesn't really speak to me because it is founded in relatively abstract academic thinking and not a great deal of actually what does it mean, and what's the thing that you can do tomorrow to make this happen. I think there's a lot of inspiration that can be taken from the social startup world, actually, that because a lot of the things like our Casserole project, like Mindings, like all sorts of things, are very much rooted in people and in a new way of thinking and a way of bringing people together around networks and collaborations. That's actually where I would look to for interesting takes on social capital. Inevitably, otherwise, an awful lot of the time, it does veer back towards day centres and local advisory charities and all of those things that are great in the local community, but frankly also all need reinvention in and of themselves to be fit for modern purpose. Certainly the guys that we work with in Surrey are keen on the LSE approach to social capital, so it's worth googling that. The name of the guy eludes me right now, but yeah.
Okay, we'll check it and add it to our list. Stu?
Yeah, well, thank you for mentioning Mindings among those terrific innovations. I appreciate that. And talking of innovation, I'm a big fan of Patchwork, and so I wanted to ask you about that. Obviously, that being a tool that allows access across multiple agencies to access contact details of other frontline staff. Now, naturally, not surprisingly, there were some issues there around sharing information governance. So could you tell us some of the problems there and how you overcame them? And as it's a government priority, do you feel that with Patchwork, perhaps we have a model that could be applied more widely across health and care?
Yeah, so Patchwork has pretty much been my life for 4 years. It's about the 4-year anniversary, actually, from when we initially kicked it off. So we kicked it off as an idea and nothing more than that, just a frustration as to how multi-agency working was still broken and how people still struggle to find each other and to do the preventative work that would keep children safe, or the collaborative work that means that you could better coordinate the care of an older person. And started with an open blog post and a call for people to come and talk to us. And that first meeting was around just about 4 years ago now, which is mind-blowing and frustrating. And I feel, on the one hand, like sort of frustrated with myself that we haven't been able to move it faster, because I always want things solved yesterday. But at the same time, what it's taught me is technology is a fraction of the solution, really. I mean, we've had to push the agenda, but we've also had to wait for the agenda to catch up in some respects as well. So now that it is a government priority, in terms of how do we overcome these challenges, whether it's post Monroe review or whatever it might be, it's been frustrating. The biggest challenges have been around information governance. So what represents personal sensitive information? What is the NHS willing to share with which other organisations, and what is it not? Just picking on the NHS arbitrarily.
Because the information isn't the patient's own information, it's the NHS's information.
Yeah, obviously. And also how you define personal sensitive is also very interesting and varies a great deal from Ministry of Justice to NHS to councils to two-person charity. So what we spent an awful lot of time doing was defining what is the minimum viable information that we are capable of sharing between the widest possible number of organisations. And unsurprisingly, that is very minimal.
A postcode.
Yeah, well, it's essentially name, address, postcode, phone number. That's it, I believe. Aliases, names that they also go by. And the intention, therefore, is to just be able to be sure that that is the same person that you're talking about, and then to connect the team around the person, which I think is really where the innovation comes with Patchwork. It's not about we've suddenly come up with a solution to overcome legislative barriers to information governance and, frankly, more cultural barriers than legislative barriers. Every time we ask, why can't we add this in? People say, just because you can't. And we say, okay, show us the legislation. And they say, well, it's not in legislation. We say, okay, what about your local policy? Oh, no, we haven't got that either. And I'm like, okay, so this is really just a cultural thing. You just feel it in your bones. And that's true of that first edge of information. But sure, there are some restrictions on the wider sharing of information, of deeper personal information, and that's fine and that's great. But our intention has always been the thicker the networks you make in a local area between practitioners, between a diverse collection of practitioners, whether it's a social worker, a policeman, a youth worker working out of a scout hut, a school nurse, whoever it might be, who has an interest in caring for a child or an older person. Surely the better connected people are, the thicker the networks, the more likely it is that you're going to reach that signal in all of the noise. That means you're going to either intervene earlier at the right time, or that would have been missed previously, or you're going to do more to coordinate your services. And we've now got to the point where Staffordshire now has those connections across over 50 organisations in the county, which I believe is a unique position for anything to be in because of all these barriers, because people are generally coming from a information sharing perspective rather than a human network connection perspective, which is hopefully the thing that we've overcome.
Blame me for most of that. I was thinking, is he talking about mindings or is he talking about patchwork here? Because my goodness, I can associate with that. It's not just about the technology.
I can imagine.
A lot of what we're having to do is go in with the technology and saying, well, here's how you implement it. And I'm actually spending more and more time now working with people, working out mechanisms about how we can deploy it and how we can get their organisations to work with it. That's the key to it, I've discovered.
Absolutely. But then you also need the technology as the sort of social object around which people come and they can, in government terms, they can procure technology, whereas procuring consultancy services, for instance, is not a done thing anymore. So if you can come with a product with services around it that help people communicate, come together, then it's a really useful mechanism. Yeah.
Well, the pace of change, obviously, due to the digital revolution is considerable. What do you think the biggest challenges will be over the next 12 months?
For me, I'm increasingly interested in fixing the inside of organisations. It's always been our main focus, but it feels like, particularly through Patchwork, where we've essentially said to government, we're credible. We can build in open source, in a secure way, in a government cloud environment. So that's kind of brought us the credibility to go deeper. And now we're starting to have one eye on things like case management and trying to not just improve case management, God only knows it needs improving, but actually to fundamentally reinvent case management for a world that is about self-assessment, trying to triage out the need ahead of times, and for the council to be left with fewer and fewer cases of more and more vulnerable people, which is where it can really play the strongest role. But what we're finding is that there are such deep-rooted vested interests in all of this, with big suppliers, with people who have proprietary technology and proprietary data, that for me it's going to take an awful lot of work for us to crowbar those things out of the organisation and really try and rewire the organisation with open standards at very least, as a way that systems can actually talk to each other without any, $100,000 being spent on connectors to extract data from one closed system to another. But actually start to think about how we can help data flow more freely. But equally, how do we give the practitioners beautiful interfaces that mean that they don't have to go on week-long training courses to understand a dumb system that really hampers the way that they work, and instead empowers them to do what they're meant to be doing, which is talking to their clients and helping them meet their own needs. So that's fundamentally what I'm interested in the next 12 months.
It is happening. I know of one particular local authority that I met with who now actually do have the line in the procurement contract that says that the system must be open, it must be able to communicate with other systems.
Wow.
And as a result of that one, there are certain telecare suppliers out there who now no longer pitch for that work.
Yeah, well, that's great. And the pressure has to come from both sides. I'm hoping that we can be one of a collection of organisations that are starting to provide a new market for councils to buy from. But it needs the councils to do exactly that from their side as well.
Well, that happened because there was one passionate individual, an organisation who fought for it.
Often the way, yeah.
Well, that's us. That's it from us this time. We hope you enjoyed it. We certainly did. And we'd like to ask you to help us spread the word. And remember, you can follow me at Shirley Ayres.
You can follow me at Dominic Campbell.
And you can follow me at Minding Stew. Now, come visit us at disruptivesocialcare.com, where you can see all of our previous shows, and also on our Facebook page at facebook.com/disruptivesocialcare. Until next time.
Until next time. Bye-bye.